Welcome to part 4 of anti-diabetic drugs. So previously I've covered metformin, DPP4 inhibitors, GLP-1 agonist, as well as sulfonylureas. So in this part I'll be covering on alpha glucosidase inhibitors. Alpha glucosidase inhibitors. So what is alpha glucosidase? Alpha glucosidase is not, it's an enzyme which is present in brush border of small intestine. What does it do? It helps in digestion of carbohydrates. Okay, so normally alpha glucosidase is an enzyme present in brush border of small intestine. It is responsible for digestion of carbohydrates. There are a few drugs such as acarbose, voglibose, and migleton. So these drugs inhibit this enzyme, inhibit alpha glucosidase. These are called as alpha glucosidase inhibitors. So what does it do after inhibiting alpha glucosidase enzyme? So after inhibiting this enzyme, it decreases the digestion of carbohydrates. It decreases the digestion of carbohydrates. Hence, it reduces the absorption of carbohydrates. So, it finally controls postprandial hyperglycemia. Okay. So let me repeat it again. So alpha glucosidase happens to be an enzyme which is present in brush border of small intestine. That's the first point you need to remember. It's responsible for digestion of carbohydrates. There are a few drugs which basically inhibit this enzyme, alpha glucosidase. These are called as alpha glucosidase inhibitors. So following inhibition of alpha glucosidase, it reduces the digestion of carbohydrates, it reduces the absorption of carbohydrates, and hence controls your postprandial hyperglycemia. Okay. So what are the side effects? Since it decreases digestion as well as absorption of carbohydrates, there are due to the presence of unabsorbed carbohydrates in the intestine, it leads to flatulence. Loose stools, as well as abdominal discomfort. Okay, so less amount of questions have been asked from this topic of alpha glucosidase inhibitors, but nevertheless it's better to learn anti-diabetic drugs in detail, because 1 or 2 questions in every exam is guaranteed. Then after alpha glucosidase inhibitors, will go to another class of drugs which are nothing but your PPAR gamma agonist. There are 2 drugs to be studied here, pioglitazone as well as your rosiglitazone. Okay, rosiglitazone was banned in India. It is banned in India. Okay, why? Because it has increased risk of causing your MI as well as stroke. So let me repeat it again. In PPAR gamma agonist, you have 2 drugs, pioglitazone as well as rosiglitazone. Rosiglitazone has been banned in India because there is increased risk of MI as well as stroke. So to understand the mechanism of action of pioglitazone, you should understand what is PPAR. PPAR is your peroxisome proliferator activated receptor. Okay, let me repeat it again. It happens to be called as peroxisome proliferator activated receptor gamma. This pioglitazone acts on PPAR gamma receptors, which are predominantly present in fat cells. What does it do? On acting by this receptor, there is increased transcription of insulin responsive gene. So essentially, it's I can put it in this way. It's a drug which improves your insulin resistance, so it makes it better. Okay, pioglitazone acts on PPAR gamma, which in turn causes your increased transcription of insulin responsive genes. That is, it enhances your GLUT1 as well as your GLUT4 receptor. Okay, it enhances your GLUT1 as well as GLUT4 receptor, which in turn causes an increased entry of glucose into muscle as well as fat. So let me repeat it again. So you have 2 drugs in PPAR gamma agonist, pioglitazone, rosiglitazone. Rosiglitazone has been banned in India because of MI as well as stroke. Pioglitazone acts on your PPAR gamma. PPAR gamma is called as your peroxisome proliferator activated receptor gamma, predominantly present in your fat cells. Okay, on action on PPAR gamma receptor, it increases your transcription of insulin responsive genes. Okay, and it enhances your GLUT1 as well as your GLUT4 receptors. So hence it basically increases your glucose into your entry of glucose into your muscle as well as fat. Hence it is responsible for, it acts as an anti-diabetic. Okay, controls your blood sugar level. This PPAR gamma agonist has been asked frequently in your exam. One of them being your side effect of rosiglitazone, that is MI as well as stroke. And other thing is pioglitazone comes with a warning. There is increased risk of bladder cancer. Okay, there is increased risk of bladder cancer. There are few drugs which causes bladder cancer, that is pioglitazone, which I have discussed now, as well as your cyclophosphamide. This is an anti-cancer drug. So extremely important. This has been asked in your NEET as well as your INI set. So pioglitazone comes with a warning that it causes bladder cancer, and drugs which causes bladder cancer happens to be pioglitazone as well as cyclophosphamide. So these are two drugs you have to remember. And of course there are drugs which cause your gallstones. Extremely important, remember. That is your octreotide as well as your fibrates. There are drugs which cause your diabetes mellitus. That is your growth hormone, tacrolimus, as well as L-aspargine. Okay, so these are like direct one-liners which may be asked in your INI as well as your NEET. Okay, let me repeat it again. Drugs which cause your gallstones are octreotide as well as fibrates, and drugs which cause your diabetes mellitus are growth hormone, tacrolimus, as well as your L-aspargine. Extremely important, remember. Okay. Other side effects of your pioglitazone include your CHF, which has been asked again. It causes your weight gain. Okay, it causes your weight gain, which has been asked, as well as osteoporosis. Okay, so this is a very important drug which has been frequently asked in your NEET as well as your INI set. Then we move on to another class of drug. Is the last class of drug which we'll be dealing with. That is your SGLT2 inhibitors. So normally SGLT2 is responsible for reabsorption. Okay, it's responsible for reabsorption of your sodium and glucose through kidneys, through tubules. Okay, kidney tubular reabsorption. So normally SGLT2 happens to be a transporter responsible for reabsorption of sodium and glucose through kidneys. Okay. Then there is SGLT1. You need to understand the difference. SGLT1 is basically present in your GI tract, whereas your SGLT2 is basically present in kidney. So these are there are a few drugs, that is